Hey, stop what you're doing right now because what I'm about to share with you could literally save your life, and your doctor may never bring it up at your annual checkup. I'm talking about something you do every single day, something so private and so routine that most people never think twice about it. But today we're going to change that. We're talking about your stool specifically, the types that could be waving a red flag at you, warning you that something serious, even cancerous, is brewing inside your body. Now, I know that might sound alarming, and I want you to take a breath because knowledge is power. I'm Dr. William Lee, and for over 3 decades, I've studied how the body fights disease from cancer to cardiovascular illness to the silent changes that happen in the gut as we age. And what I'm going to share with you today is based on real science, not internet myths. Here's a number that stopped me cold when I first read it. According to a landmark study published by the American Cancer Society, colorectal cancer is the second leading cause of cancer death in the United States. And adults over the age of 65 account for nearly 73% of all new diagnoses. 73%. And the terrifying part? In a majority of those cases, warning signs were present months, sometimes years before diagnosis. They were just ignored, or worse, never recognized. Today, we're going to make sure that doesn't happen to you. And I'll tell you right now, item number 2 on our list today is something almost every senior dismisses as just getting older. And it is the one sign I find most concerning in my clinical experience. You'll want to stay all the way through for that one. But before we dive in, I want to ask you something personal. Leave a comment below and tell me, how old are you? And have you ever noticed a change in your digestion or bathroom habits that you just brushed off? I genuinely read every single comment on this channel, and your answer might help someone else watching today who needs to hear that they're not alone. We're counting down from number 5 to number 1, from concerning to the most urgent warning signs hiding in your stool. Let's begin. Coming in at number 5, and this one surprises almost everyone I tell it to, is stool that floats consistently, especially when it's also pale or greasy in appearance. Now, most people were told somewhere along the line that floating stool is a sign of a healthy, high-fiber diet. And occasionally, that's true. But here's what they never told you. When stool floats regularly and looks greasy, oily, or leaves a film in the toilet bowl, it can indicate something called fat malabsorption. That's a condition where your gut is no longer properly absorbing dietary fats, and the fat is instead passing directly into your stool. Think of it like a clogged filter in your car. The oil isn't being processed. It's just passing right through. Researchers at the Mayo Clinic have documented that persistent fat malabsorption in adults over 65 can be an early marker of pancreatic dysfunction, including pancreatic cancer, one of the most dangerous and least detected cancers in older adults. A study published in the journal Gut found that patients diagnosed with pancreatic cancer reported changes in stool consistency and buoyancy an average of 14 months before their diagnosis. 14 months of warning that many people simply missed. Here's why this hits seniors harder. After the age of 70, your pancreatic enzyme output naturally declines by as much as 40%, according to research from Johns Hopkins Medical. That means your body is already working harder to digest fats. When you add pancreatic inflammation or early cellular changes into that equation, the system starts to break down and your stool becomes the messenger. What should you do? Start paying attention. If you notice floating, greasy, or particularly foul-smelling stool more than 3 times per week for 2 or more weeks in a row, don't wait. Bring it up at your next appointment or call your doctor before that. Keep a simple log. Note the date, the consistency, and whether it floated or sank. This kind of detail is gold for a gastroenterologist. And pair that conversation with asking about a fecal elastase test, a simple, non-invasive stool test that can detect pancreatic enzyme insufficiency. Many doctors won't order it unless you ask specifically. You now know to ask. Coming up at number 4, we're looking at something that has a color most people associate with their diet, but when it shows up persistently, it signals something far more dangerous lurking in the lower digestive tract. Number 4 on our list, dark, Tarry, or black stool that you haven't explained by iron supplements or certain foods. Let me be very direct with you here. If you see stool that is black like tar, sticky in texture, and has an unusually foul odor, and you have not recently taken iron supplements or eaten large amounts of beets, dark chocolate, or licorice, you need to contact your doctor the same day you notice it. Not next week, the same day. This type of stool, clinically referred to as melena, is one of the most well-documented warning signs of bleeding in the upper gastrointestinal tract, the esophagus, stomach, or upper small intestine. When blood travels through the digestive system before being excreted, it gets broken down by stomach acids and intestinal bacteria, which turns it from bright red to that distinctive dark tar-like black. Think of it like rust forming on iron. The blood oxidizes and changes color the longer it sits in your system. A study published in the New England Journal of Medicine found that gastrointestinal bleeding in adults over 70 carries a mortality risk that is 35% higher than in younger adults, largely because seniors are less likely to present with acute symptoms and more likely to dismiss early signs. Researchers at Stanford Medical Center identified that upper GI bleeding, when caught within 48 hours, has a treatment success rate of over 80%. Caught late, that number drops dramatically. The reason seniors are uniquely vulnerable is a combination of factors. Long-term use of NSAIDs, that's non-steroidal anti-inflammatory drugs, things like ibuprofen or aspirin taken regularly for arthritis or joint pain, can erode the stomach lining over time, creating ulcers that bleed quietly and slowly. At the same time, the mucosal lining of the gut, which is essentially your stomach's protective coating, thins by approximately 25% after age 65, according to research from the University of Michigan's Gastroenterology Department. My patient Margaret, a 71-year-old retired school teacher from Boise, Idaho, came to see me after her daughter practically dragged her into the office. Margaret had noticed her stool had looked a bit dark for about 3 weeks. She assumed it was her daily aspirin. It was not. A prompt endoscopy revealed a bleeding gastric ulcer that had begun showing precancerous cellular changes. Because her daughter noticed and because Margaret finally spoke up, we were able to treat it completely. Margaret is now 76 and in excellent health. That conversation saved her life. This is why I keep saying your stool is speaking to you. The question is whether you're listening. Now, if you're finding value in this information today, here's a small ask. Hit that like button right now. It takes 2 seconds, and it tells YouTube to share this with other seniors who might desperately need to see it. And if you haven't subscribed yet, please do. We release videos every week specifically designed to help adults over 60 protect their health with real, evidence-based information. Tap subscribe and hit that bell. It genuinely matters. Now let's move to number 3, and this one involves a shape that most people have never been told to look for, but that gastroenterologists consider one of the most reliable visual markers of trouble in the lower colon. Number 3, pencil-thin or ribbon-like stool that appears consistently over several weeks. Here's something fascinating and frightening at the same time. The colon is a muscular tube, roughly 5 feet long, and its inner diameter is about the width of a garden hose, somewhere between 1 and 2 inches across. Under normal circumstances, stool forms to roughly fit that space. When stool suddenly starts coming out consistently thin, pencil-thin, ribbon-like, or flat, it means something inside your colon is taking up space. Something is narrowing the passageway. That something could be a tumor. Research published in the journal Diseases of the Colon and Rectum found that persistent changes in stool caliber, meaning the width and shape of stool, were reported by 64% of patients who were later diagnosed with colorectal cancer, 64%. And in adults over 65, the same study found that those symptoms were present for an average of 19 weeks before a diagnosis was made. Nearly 5 months of pencil-thin stool going unexplained. Now, I want to be careful here because thin stool can also be caused by irritable bowel syndrome, spasms in the colon, or even dietary changes. A single occurrence means nothing. What I'm talking about is persistence. If you are consistently noticing that your stool has become thin, flat, or ribbon-like over the course of 2 weeks or more, and this is a change from your normal, that is a conversation that must happen with your gastroenterologist. The aging colon is particularly vulnerable to this kind of change because of something called decreased colonic motility, which simply means the colon's muscle contractions slow down as we age. After age 75, motility can decrease by up to 30%, according to data from the Cleveland Clinic. This slower transit time means that early polyp small growths on the inner lining of the colon have more time to grow larger before they cause noticeable symptoms. By the time they narrow the stool, they've often been there for years. The practical step here is straightforward but critically important. Get your colonoscopy, and if you're over 75 and have never had one, speak to your doctor about whether a non-invasive stool DNA test like the Cologuard test might be appropriate for you. These tests can detect the DNA shed by precancerous and cancerous cells in the colon, right from the comfort of your own home. Science has made early detection accessible. Please use it. Pair your colon health with a diet rich in resistant starch found in cooked and cooled potatoes, green bananas, and legumes because resistant starch feeds the beneficial bacteria in your colon, reduces inflammation, and has been shown in a Harvard School of Public Health study to lower colorectal cancer risk by up to 27% in older adults. Now we're approaching the top two, and this is where things get deeply personal. Number 2 is the one I mentioned at the top, the sign that almost every senior I've ever spoken to has dismissed as normal aging. Please do not look away. Number 2, a persistent, unexplained change in bowel habits lasting more than 3 weeks, especially alternating between constipation and diarrhea. I want to tell you something that took me years of clinical practice to truly appreciate. Your bowel habits are like a fingerprint. They are uniquely yours. And just like a fingerprint doesn't change unless something forces it to, your bowel habits don't change persistently without a reason. When patients come to me describing weeks of alternating between being constipated for 4 or 5 days and then having sudden urgent diarrhea, sometimes accompanied by cramping, incomplete emptying, or the feeling that they never quite finish, I take that seriously every single time. This pattern is what gastroenterologists call altered bowel habit. And according to a multi-center study published by the British Journal of Cancer, it is the single most commonly reported symptom across all colorectal cancer diagnoses, present in 71% of cases at the time of confirmed diagnosis. Here's the biological reason this happens, and why seniors are particularly at risk. As a tumor grows inside the colon, it disrupts the normal muscle contractions that move waste along. Sometimes the tumor causes blockage, leading to constipation. Then the body responds by producing excess fluid to push past the obstruction, creating sudden diarrhea. It's a tug of war happening inside your gut, and you feel it every day without knowing what's causing it. The danger for seniors specifically lies in something I call the normalization trap. After decades of life, we tend to chalk changes up to aging. I can't tell you how many patients, intelligent, health-conscious people have sat across from me and said, "Oh, I just thought I was getting older." Constipation increases with age, that's true. But persistent alteration, going back and forth for weeks without explanation, is not normal aging. It is a signal. My patient Robert, a 78-year-old retired engineer from Nashville, Tennessee, had been telling his wife for 2 months that his stomach was just off. He was alternating between constipation and urgency, had lost about 12 pounds, and occasionally felt a dull ache in his lower left abdomen. He assumed it was stress from a recent move. His wife finally insisted he come see me. A colonoscopy revealed a stage 2 colorectal tumor in his sigmoid colon. Because we caught it at stage 2 contained, not yet spread, Robert underwent surgery followed by a short course of chemotherapy and is today, 2 years later, cancer-free. He sends me a Christmas card every year. The weight loss component I mentioned is critical. Unintentional weight loss of 10 or more pounds over 6 months, combined with altered bowel habits, elevates cancer risk assessment dramatically. If you are experiencing both, please act today, not tomorrow. The step you take here is scheduling a visit and being completely honest with your doctor. Write down exactly what you've noticed, when it started, how often it happens, and any other symptoms. Don't minimize. Don't say, "I'm sure it's nothing." Let the doctor decide that after the evidence is in front of them. And now, number one, the single most alarming stool type that I believe every senior must know. This is the one that requires immediate action, not a scheduled appointment right now. Number one, blood in the stool, whether visible red blood, streaks of blood, or blood that shows up only on a fecal occult blood test. This is it. This is the warning sign that outranks every other item on this list because of how consistently it appears in colorectal cancer cases and how consistently it is either missed or rationalized away by people who see it. According to the American Gastroenterological Association, rectal bleeding blood in or on the stool is the presenting symptom in approximately 78% of all colorectal cancer diagnoses in adults over 60, 78%. And yet study after study shows that the average time between first noticing rectal bleeding and seeking medical attention is over 6 months. 6 months of waiting. 6 months of a potential tumor growing, spreading, and changing from something treatable to something catastrophic. Here is what I need you to understand. Blood in the stool comes in two forms, and both matter enormously. The first is visible bright red blood on the toilet paper, in the toilet bowl, or coating the outside of the stool. Many people assume this is hemorrhoids, and sometimes it is. But you cannot tell the difference between hemorrhoidal bleeding and tumor bleeding just by looking. You need a professional evaluation every single time you see blood. Not once. Every single time. The second form of blood is invisible to the naked eye. It's called occult blood, meaning hidden blood. It can only be detected by a fecal occult blood test, also known as a FOBT, or by the more sensitive fecal immunochemical test, called FIT. These are simple tests your doctor can order, or in some cases you can purchase at a pharmacy. A study from the University of California, San Francisco found that annual FIT testing in adults over 65 reduced colorectal cancer mortality by 33% over a 10-year period. 33% of lives that could have been saved simply by doing a yearly stool test. Why is occult blood so dangerous for seniors specifically? Because the mitochondria, the tiny energy-producing engines inside your cells, begin to function less efficiently after age 70, and your body's overall surveillance system for detecting damaged or mutating cells slows down. This is also related to a phenomenon called inflammaging, a term researchers at the National Institute on Aging use to describe the state of chronic low-grade inflammation that permanently settles into the aging body. Inflammaging weakens the gut lining, promotes polyp formation, and reduces the body's natural ability to contain early cancerous growth. In this environment, a small bleeding polyp can evolve quickly. The practical step at number one is the most urgent I will ever give you on this channel. If you see blood in your stool, visible, consistent, or even once in a way that concerns you, call your doctor today. Not after the weekend, not after the holidays. Today. And if you are over 65 and have not had a fecal immunochemical test in the last year, ask for one at your next visit or pick up a test kit at your local pharmacy. You can also enhance your colon's protective defenses naturally. Research from Harvard Medical School has shown that omega-3 fatty acids found in fatty fish like salmon and sardines reduce colon inflammation by up to 29% in older adults. Pair that with curcumin, the active compound in turmeric, which a study from MD Anderson Cancer Center found inhibits the growth of colorectal cancer cells in lab studies. I'm not saying food replaces medicine. I'm saying that while you're taking the medical steps, you can also be feeding your body the ammunition it needs to fight back. Scientific references for everything I've discussed today are listed in the description below. Please share this video with someone you love, a parent, a sibling, a friend. You may never know which conversation saved a life. Let me leave you with this. I have spent over 30 years studying how the human body fights disease, and the one truth that has never changed is this. The body always sends signals. It never goes silent without a reason. The stool types we discussed today, floating and greasy, dark and Tarry, pencil-thin, persistently altered, and bloody, are not random events. They are your body's way of asking for help. They are the language your gut speaks when something needs attention. You have earned your years. You have raised families, built careers, survived hardships, and created a life worth protecting. It is never too late to pay attention. It is never too late to ask a question. It is never too late to walk into your doctor's office and say, "I've noticed something and I need you to help me understand it." That single act of advocacy for yourself could be the difference between catching something early and waiting too long. Your independence, your quality of life, your ability to be present for the people who love you. None of that has an expiration date unless you stop fighting for it. And I refuse to let that happen on my watch. If this video helped you today, please subscribe to this channel right now and hit the bell so you never miss a video. We are here every week with science-backed, senior-focused health information that your doctor may not have time to tell you, but that you absolutely deserve to know. And now I want to hear from you. Have you ever noticed any of the warning signs we discussed today? Did you bring it up with your doctor or did you brush it off? Leave your story in the comments. I read every single one, and your experience might be exactly what someone else needs to finally take action. See you in the next video.